Well, thank you very much, Alfred. I don't know if I'd call myself a super alumnus, but yes, I am alumnus. I'm from the School of Medicine from the last century. But anyway, I'm still here, as some elderly gentlemen told me one day when I was walking in the park. I saw them and they said, "Hey, how you doing?" And I said, "I'm doing fine, how are you?" And they looked at each other and go, "Well, we're still here." So first of all, I'd like to welcome you all to this joint event that is sponsored by the UC Chicano Latino Alumni Association in conjunction with the Alumni Association of UCSF in the Alumni Weekend. And I'm a family practice doctor. I'm on the board of directors for the Alumni Association here at UCSF. And so they've asked me to introduce our moderator, Dr. Jose Barrel Sanchez, who's the Vice Dean of the UCSF School of Medicine Regional Campus at Fresno, where he oversees medical education, faculty and staff development, research growth, and strategic partnerships, including expanding the collaboration with UC Merced. Now, from all that, you can tell he's definitely a Mexican. Okay. He also serves on the UCSF School of Medicine's Council. He's an experienced academic leader, educator, and researcher, previously holding senior leadership roles at the Kaiser Permanente Bernard J. Tyson School of Medicine and the University of Texas Medical Branch. He was a Pew Scholar in Biomedical Sciences. His research on neurodegenerative disorders has been published in Nature, Cell, and Science. Now, I have to mention that he's also a distinguished graduate of the Tecnológico de Monterrey School of Medicine in Monterrey, Mexico. Okay. He's deeply committed to faculty mentorship, training development, and strengthening the healthcare workforce in the San Joaquin Valley. Please join me in welcoming Dr. Barral Sanchez as our moderator for today's panel discussion.
Thank you. Thank you so much, Mark, for that very, very kind introduction. And buenas tardes, ¿cómo estamos? Bien, muy bien. It's a real privilege to be here with this esteemed panel of healthcare providers and educators and researchers and advocates. So I would like to begin by asking you to please introduce yourselves. Tell us a little bit about, I know that most people in the audience know who you are, but for those of them who may not know, tell us a little bit about yourself, and then we can get started with some questions. And then toward the end of the session, we will make sure that we have time to ask questions from the audience as well.
Okay. Ladies first, or do I go?
You go.
Okay. Sure. Buenas tardes. Good afternoon, everybody. My name is Adrian Espinosa. I'm an alumni from the School of Nursing. I'm really happy to be here because I think nursing needs a lot more representation in the healthcare field. We're out there as advanced practice providers. I work as a family nurse practitioner at a federally qualified health center, and I'm really proud of the work that we do and of my colleagues and the work that we do. We're part of a huge safety net. And growing up, I didn't see many faces like myself in practice, and when my parents and my family members would go receive treatment. So for me, it was a mission in life to continue working in nonprofit and community health. So it's an honor for me to be here on this panel with this esteemed guest, and I hope we can share some of our story with you guys today. Thank you.
And my name is Faustina Nevares. I graduated from UCSF in 1979. Some of you haven't been born then, but I graduated with the esteemed mentor, Mark Diaz. And yes, we did UC Davis together for 4 years, and then we went to medical school together. And together we were founded the longest standing student-run clinic in Clínica Tepati. And that was, and it's a privilege to see that it is still running. It was a fabulous experience for myself. After that, I went to Kaiser Los Angeles Tertiary Care Center for Southern California. I did lots of clinical work as well as some administrative work. I was a chief of service for 15 years. Yes, the first woman and definitely the first Latina. Yes, it was a wonderful time. I had wonderful experiences on the board of directors there, and then at my retirement, went to work at Altamed. Many of you might be familiar with Altamed. It's the largest FQHC in the country, covering Los Angeles and Orange County. They did not have an OBGYN department, but they do now. They have an excellent OBGYN department that does everything. I mean, they do robotics now. They have full services. I'm very happy to say that some of the experience that we gained together in building everything from the ground up at Clínica Tepática served me for the remaining 45 years. And also, I really have to thank these two gentlemen that I knew in medical school, and they'll introduce themselves, but they too were dear friends, and probably the most important thing that I learned, and you can take my time off the other questions.
You're good, you're good.
Yeah, is how important that network of support was. The kids in the audience, and you're not kids, obviously, you're full-grown adults, but the folks that are going into school now have no idea, and hopefully one day will understand what it was like when we were in school. It was a different story, but because of this work of these wonderful people, including Dr. Diaz and others, we're at a different place, and we hope to continue that. Mark.
Well, I'm Dr. Mark Cave, and I'm a dentist. Nobody get afraid, okay? And I went to UC Berkeley, the only college I applied to. My mom had gone to Berkeley in 1945. Wow. And graduated with her nursing degree, BS in nursing. Woo. And she set a high bar. So it's the only place that I wanted to go. And so gravitated toward the health field. She was a health educator at the Oakland Public Schools for 35 years, school nurse. She asked for some of the Chicano schools, they give them all to her. So, and she served that community well. And it was for somebody I really looked up to. So I went to dental school because my dad was friends with all his dentists, and I thought that would look like a cool job. And I applied to 4 schools. I got into UCLA, NYU, USC, and UCSF. And I talked to my sister-in-law who was going to USC at the time, and she talked me into going to UCSF. So I was really glad I made that choice. It was a wonderful school. It taught me not only how to stay current. I graduated in '78. So,
Okay,
but to work with, I work with a lot of young providers now. I'm the director of dental providers at Clinica Sierra Vista. We're top 5 in the United States in federal qualified health center grantees. We have 30 sites, 1,600 employees spreading from Kern County to Fresno County. And at any rate, it serves me well to be able to communicate with those providers, to speak their language, to understand their needs and priorities, and to serve them, in addition to serving my patients and my team. So I really enjoyed that. After dental school, I got a master's in public health because somebody influenced me that was a thing to do. They told me I was an unrepentant clinician, and so I went into private practice in Visalia, California, which I've enjoyed for a long time. I'm still in private practice. I have a hobby practice now, but I love it, and I'm glad to finish my career back in FQHCs where I started. I think it's a great chance to serve people and to find a way that we're going to serve people in the future. I see it as the future of dentistry. Private practices are pretty soon not going to be around anymore, in my opinion. And it's getting harder and harder to find those jobs to take on that liability and risk. And young providers are coming to us for jobs. We are the job center for dental providers in the country and the source of growth. I was working there, and I fell at work, and I found out about the workman's comp system. So now I'm a QME. I'm qualified medical evaluator for the state of California. I look at injured workers and help them with their dental injuries, and I actually work for the judge. And it's been a fascinating learning experience, and something that I really enjoy doing. So another way to help people.
I'm David Hayes Bautista. I'm currently Distinguished Professor of Medicine and Director of the Center for the Study of Latino Health and Culture at UCLA, the only campus of the UC system founded by a Latino, but that's a whole nother story.
Our historian.
So
Right.
I'm a UC product. I started out at UC Davis, studied engineering, got tired of being the only Chicano on campus. But then my roommate's brother visited. He said, well, you know, there are 25 Chicanos at Berkeley. I went down to check it out. And sure enough, so I transferred, met some great people that I've worked with all my life. We got involved in setting up clinics. I got involved in helping set up La Clínica de la Raza in Oakland. Castello de la Rocha did Altamed. Joel Garcia did the Tiburcio Vasquez. So that's what we did for a hobby while we were undergraduates at Berkeley. Then I came to UCSF 1970. We were the first group of Latinos actually admitted. Before, UCSF had admitted like one Latino every 4 or 5 years. There were 12 of us all of a sudden. They didn't know what to do with us. So we formed CHE. Okay. Well, the story on that, we were meeting at the old Millbury Union in the dorms. I can't remember whose room it was, but he had that poster of Che, you know, with that 1,000-yard stare. We got to call it Che. We just have to, but what does it stand for? We finally figured it out. And also working with Dr. Bob Montoya, setting up the National Chicano Health Organization. And then I went on to faculty at, I graduated from UCSF in 1974 in the basic sciences. And then I took my first position at Berkeley at the School of Public Health, where I met this man and a number of other folks in the room here. Went up to full professor, then UCLA made me an offer I couldn't resist. My family, I was born in LA, my family's been there about 130 years, so I thought it was time to go back home. So I've been at UCLA ever since. But there are probably 2 pieces of research that I think it's really important that we understand, because sometimes we don't know who we are. We don't have a narrative of who we are. I wrote my first book starting in 1980, and I projected that by 2030, there would be 14.9 million Latinos in California, and we'd be 48% of the population. Well, guess what? I hit every decennial census on the nose. In fact, a little bit ahead, we are 15.3 million and 40% of the population. You can still buy the book, by the way. It's published by Stanford. My most recent publication we just released 2 weeks ago. You may have heard about it. We also do the work on the Latino GDP. And our report, we're going to be doing a briefing, by the way, on Cinco de Mayo at UCLA. The 68 million Latinos in the United States, if we were a separate country reporting, have generated the world's 4th largest economy at 4.4 trillion. We have now surpassed Japan. We have a larger income than Japan, growing much faster than Japan. We rule this planet. We can move it. We don't rule it, but we move it. But sometimes we don't give ourselves credit for what we have done and what we can do. So I'm working on the next generation right now. I'm looking out at 2095. I've already got my projection for 2095. We'll talk about that later.
Right. Thank you. This is wonderful. So I want to go back a little bit into, if you can tell us about your connection to student-run clinics and community clinics and you know, those that emerge as a result of the Chicano health movement and the struggles for health equity. So what drew you to that work? And you know, talk a little bit about those early days. And we can go in any order.
Well,
start from there and then we come back.
Okay, we'll go back. Well, we formed CHE. And we wanted to do, we were aware, we were the first group at UCSF as a group. We wanted to outreach to high schools. It was clear there were no faculty, very few students. We wanted to do outreach, recruitment, We wanted to get involved with community clinics. So we formed ourselves, and we went to Phil Lee, the chancellor then, the big liberal, right? He just came in from the East Coast. And so we said, here's what we want to do. And he said, no. We just got rid of segregation. Now you're being reverse racist. You shouldn't set up a separate thing. Why not? We have a perfectly good group, the Student American Medical Association. Remember Sama? It was just carbon copy of the American Medical Association. We said, what? Oh yes, you'll learn everything you need to do. We said, no, they don't do what we want to do. But no, you're in healthcare, you need to do what the profession. We said, no. We didn't realize at the time what we were trying to do is develop our own voice in the health professions.
Exactly.
We did so by developing las clínicas. We didn't follow any set model. We weren't a hospital-based. We weren't a private practice-based. In fact, we had to write our own legislation just to exist so we could get insurance reimbursements. But ever since then, all of us have been trying to find our voice, our role. I now do this at the research level with the research labs. I teach a doctoral seminar on theory, method, and data in Latino health research because every model I was taught here at UCSF to try to explain Latino health do not predict the outcomes. I study the Latino epidemiological paradox. Overall, California, New York, doesn't matter where, we have 30% fewer heart attacks than non-Hispanic whites, 30% fewer cancers, 45% fewer accidents, 65% fewer deaths due to chronic or respiratory. We live 3 years longer. We smoke less, we drink less, we do drugs less with low income, low education, and horrible access to care. How do we do it? And no model describes it because they all assume that minorities are from the beginning dysfunctional. We can't do anything right. We've never done anything right. Whether it be the urban underclass model or the assimilating immigrant model, whatever else. We need to create our own knowledge, science-based, data-based. I am a researcher, but their models do not work. They cannot describe how our babies come out so healthy. They cannot predict that. So we need to create, as scientists, as researchers, as PIs, a new epistemology of health with our own models using data. And I'm a data guy, but we don't have it's not being taught here. It wasn't taught to me 50 years ago, and it's not being, I can tell you what they're teaching, and they're still teaching the urban underclass, social determinants of health. Tell me your zip code, I'll tell you when you die. Baloney, depends. If a Latino lives there, is in that zip code, they'll die 3 years later. But the models don't pick it up. So we need to create a new world of knowledge for a California that is 40% Latino, for the children that are 55% Latino, that this institution, and I love it, but they can't describe, they can't predict that we would produce the world's 4th largest economy. They think we're all living on welfare. We need to change that based on science. That's what we did.
Follow that.
I did. He graduated in 74. I graduated from Berkeley in 74 and started UCSF in 74. So that's what I grew up with. And it's what I wanted to do. I worked for El Visto Family Health Centers here in San Jose. My first jobs, I really enjoyed it. But it was a different kind of a world that was kind of stitched together. So we decided, Dr. George Castaneda, who had started the United Family Health Center dental grants in Orange Cove, California, he decided he was going to build his own public clinic in North Visalia, which is the Barrio Visalia. And so I looped into that, and it was a dream. Sometimes dreams don't always work out. But it was an interesting experiment in trying in a Chicano-owned business in a Chicano community. And like I said, it was a valuable learning experience. And I stayed in Visalia because I was there, and I learned to love the valley. I learned to love the people there. It's very hard for me to come here. But I came because my friend Mark asked, so, which is all it takes. We've been friends since medical school, and we were the first Chicano student body presidents at UCSF, and I think pretty much anywhere. So it gave us a chance to lead in change, and I saw the community clinics as a way to create change. And I think they remain important because we were comfortable. The patients that come to us know that we're going to listen to them, we're going to hear them, we're going to respect them. I work on people I see in my family. And you can't, I don't know. What I love about when I work in the community clinics, I get to do the work that the patient needs, not the work that I need. I get to take care of what people. It's a hoot. Today's my 74th birthday. I just signed up for 5 more years with these guys.
Feliz cumpleaños.
Happy birthday,
Feliz
Mark.
cumpleaños.
Happy birthday.
Mañanitas.
My turn? Well, I agree. I was following as well. We named Che at UC Davis after Che at, where was it, Berkeley or UCSF? or
UCSF
both?
first, here.
Here
The
first.
Millbury Union with a poster of Che Guevara.
We had options. That's right, we did too. We had options. We could have gone with Chicano's CCM, Chicanos are Creative Medicine, and UCLA, but we didn't. We stayed Northerners. We're very committed that way. But I think it's important they touched on something because many people say, why do you need brown faces in medicine? Why are you more skilled at handling the problems of the 40% of the Latino community? And you do not realize it as a practitioner, how people, number one, are continuing to look down on you like you're not really, and certainly in my class, it was like, you're not really a doctor, you came through EOP. Well, no, I didn't actually, but okay. EOP was the equal opportunity. And we're going through a lot of discussion now. Everybody doesn't have to be at the table. We just have to have the very best. Well, define what very best was. So these were fights that will continue and are continuing now. What I did learn from UCSF, and it was a real important lesson, is at the time that I entered medical school, less than 10%, and I'm going to defer to Dr. David Hayes-Bautista for the actual data, but there were very, very few women, period, in medical schools, period. So how did UCSF change that? Does anyone have an idea? Does anyone actually know? No one's that old? Oh, okay, I'll tell you. What happened is they realized that they needed to have women faculty or alum in the process of interviewing and the admissions committee. So where were the faculty and where are the alum if you're only graduating less than 10%? Well, they couldn't find them. So a year or two before, this was during the Vietnam War, they decided to find women leaders in business, community groups, etc., community leaders. And they put the women on the admissions committee. So did that change admissions? Yes. So what is going on with our community? Why have we not made more headway? Why do we not have more faculty? Because there are still gatekeepers. People feel comfortable with who they get comfortable with. And I am constantly having to explain, Dr. David Hayes-Bautista does it for a living. He does it much more eloquent than I do. But you're comfortable with what you're comfortable. And that's okay. As long as you understand that if you hold the power and your population doesn't look like you, maybe you ought to get comfortable with what your intended job is. And if you're supposed to graduate healthcare providers for a specific population, well, maybe you got to get comfortable with that population, right? And those are the kind of questions that we had to face as first-year medical students and applicants, because nobody could figure out why you had to have women in medicine, or definitely why you had to have minorities in medicine, which is hard to say in California when you're Hispanic, Mexican American. But Clínica Tepati helped, being given that support by the faculty at UC Davis, I think was very, very special and important. And I went back to look at the clinic. We actually started the clinic at Davis in a, oh gosh, what was that? It was the Mexican American Counseling Center, yeah. And they said, okay, you can borrow our offices. And then we gave awards. They were just simple paper awards to the faculty and They donated money and everybody felt good about the project and it was fabulous. It was the first place that many of the people of Sacramento touched the healthcare system. Now, I am not an advocate of free clinics, but sometimes that's all we got. Go ahead.
Thank you. Now, how do I follow those three, right? But there's actually something beautiful that I want to touch on with generational wealth. But starting off, my parents were campesinos in the Salinas Valley, so they taught me the value of education and just how important it was for us. And fast forward to doing my graduate at San Jose State, we started one of the chapters for Che there after everything that we had seen in the Bay Area. And throughout my journey, I think I always tried to navigate and find my support system because it was strong for a lot of the pre-med students. And I found, my hermanidad and with my colleagues that were in pre-med, but I wasn't sure that was my path. I did go into public health for about 8 years and I loved it, but I still felt that need for the clinical training. But seeing the beauty of what they created and that I became part of that later, now it feels great, like a full circle moment, hearing them talk about starting the Ches and us doing those as I was going through my educational journey. So I think having that lived experience really was valuable for me. Seeing my family use community clinics, seeing the experiences there, and like you said, to this day we still face these challenges. I remember right now, as you're speaking, one of my patients that I often think about that came in, multiple chronic conditions, hadn't been in care for a while. We finished the visit. I ran behind in clinic, but I felt like we needed to sit and go through everything that he wanted to talk about and also see where we would start, right? Because you can't handle everything in one visit. And when I was about to leave, he asked me, will you keep me as your patient? Will you be my provider? And I said, yeah, they assigned you to me. Yeah, you're my patient. He's like, are you sure? And it caught me off guard at first. He was Latino. He's a Latino patient. I said, yes, I will be your provider. And as I walked out and I looked at the chart again, and I thought about it. In the chart, there was a lot of non-compliant patient, So for about 1.5 years, he had been bounced around to more than 5 providers. So the fact that he reminded me that by taking that time with him, he felt valued and he felt that we understood him. Those are the moments that remind me of why we're here and what we do. So I think that's the beauty of why we continue to do the work that we do, and it's still needed because it's still happening.
Wonderful. Thank you so much for sharing all these past and current experiences. And what I hear is that you have had to do your work as clinicians, researchers, educators, advocates, and at the same time be leaders. And so can you tell our audience how those experiences shaped your leadership style, how you are as a leader now, and what those skills are that we need to have to be advocates as you have been?
Let me start.
Anyone?
Go ahead.
Okay, go this way. Okay.
Yeah.
I've had to learn to speak up. I was often sometimes timid and shy, and I would think, I don't want to say the wrong thing, or I don't know if I'm going to sound smart, or I don't know, And but it came to a point where I realized that if I didn't advocate for myself, no one else would per se, But later I did find wonderful mentors and allies. But I think that's something that I am very proud of that I have developed, and I pay it forward. I think that one of my gifts that Diosito gave me was to be able to empower others to also realize their strengths. I'm proud to be one of the co-founders and current president of the Society of Latinx Nurses, a national nursing organization where we're trying to bring more inclusivity and break down the barriers of a lot of racism going on within our own nursing profession, but also creating safe spaces so we can mentor and have more trained professionals out there. So just in general, being able to be out there, be outspoken, speak about the hard topics, create those safe spaces. I've been able to go into hospital systems and host meetings and trainings where, at one time I would be really intimidated, but now I go in and I think, we add value. We all have a shared experience. And I think that sometimes just sharing that walk that we've had, in our paths is something that people can relate to. And I never get tired of hearing someone say, I thought I was the only one. Thank you for sharing your story. I think that's something that you should all always remember, that your story carries a lot of weight. And sometimes people still feel alone out there. So hearing your story and what you've been through can be something that really resonates with somebody. So I think that that's one thing in my leadership style that I really appreciated. and I continue to advocate and hopefully be a voice out there. And I will continue to as long as I can. Being full-time primary care is not easy. Some days I'm saying, I'm going to radio, I'm going to go do something else. But then I think, you know what, I'm meant to be here, and the reward is greater there. And as long as I can do it and pay it forward and work with others and with wonderful colleagues and to continue to build a community, it's well worth it and part of my leadership building still to this day. Thank you.
Yeah, nice. I think that being able to articulate why you think you're doing what you're doing with your life is very important. And it does require that you think about it. Why do you deserve a place on the table? And it's not that you don't deserve, you do, and we need you very badly to represent the people that you're going to care for. But you have to be able to articulate that. It has to be in your soul. Now, it's articulated beautifully in all because I was on the admissions committee at UCSF for medical school. But sometimes they forget. Everybody wants to save the world when they're young and they want to be a doctor and they're telling you how important it is to them, and then they forget. So what you need to do, what I found that I had to do, is I had to answer back to people who were senior than me, which weren't that many since Montoya, when he graduated, I think he was the only one out of USC in 1969. Mm-hmm. Dr. Montoya is fortunately still alive, a great colleague and a great leader who created the pipeline for many, many Latinos to come into medicine. And probably the most important, he says, is, you can do it. If he can do it, you can do it. If you can do it, he can do it. And the dear man was one of the worst dressers in the whole world. Now, I love him. He's like my compadre. But I looked at him and I said, okay, if that's a doctor, I can do this. And sometimes that's okay. If you don't see something of yourself that is common and comfortable, then you won't move forward. And I think it's part of leadership, too, is to make feel comfortable. The other thing I ask myself is, my theory valid? You said it was. I actually have studies we did at Kaiser where we had East LA, which is 95% Hispanic, with a lot of Hispanic doctors, because my husband was the PIC there and made sure we had lots of Hispanic doctors. And then there's Woodland Hills, which is lovely, but it's got a lot more money on the other side of town and not so many Hispanics. And so we rated compliance of the different groups that we served. Mm-hmm. And it was true. Populations who feel comfortable with their providers are more compliant. Does that not make you a better doctor in what you're trying to do? And that study came out and was following the compliance improvement in diabetic treatments. And so as you go through, you start seeing things, and then you can even validate them in research. And that, I think, is very, very important. And I won't go on about that because we've got our expert here as well. In leadership, I was we've got enormous leaders, and I think it's just because we have the opportunity to speak, and the challenge to say, I don't believe you. And when people challenge you, and you can respond without being threatened or angry or like other people we know, but actually respond in a thoughtful, I'm sorry, I promised I wouldn't say that, right? Right, okay, don't worry about it. I didn't say anything.
We love it.
No. It's really important for you to feel comfortable in examining yourself and believe the things that you're leading about. And I was very fortunate in whatever skills I picked up, thanks to very much of these people who are here, to take some serious leadership positions at Kaiser, at our tertiary center in Los Angeles and Southern California, as well as the board of directors. It served me well. And yes, I was the shortest and the brownest person in the room. And one of the only women at the time.
Well, as I said, I got to UCSF just after these guys kicked open all these doors. And suddenly, it's one thing to fight a war, it's another thing to survive the peace. How do we keep those open? How do we give opportunities to others? I was lucky. These guys had fought a hard fight, and they'd won a lot. It fell to my generation to become operational, to take advantage of those opportunities that were created for us, and to make them open to others. So I sat on the admissions committee. I got to help a little there, a few people. I was the academic administrator. I ran the recruitment and retention program for UCSF after I graduated for a couple of years. I hand-built dental students and got them into school or other schools. And I was really pleased to be able to have that opportunity. I'm here today because I'm still making payments. And if it hadn't been for others, I wouldn't have learned to take charge of the opportunities to lead and create, again, openings for other people that are coming along, the new generation. I found out you could either pull the wagon or you could drive it. And I like driving sometimes. So I have a really great job. 2 days a week, I'm a clinical dentist. I fix teeth, and 2 days a week, I get to drive the wagon. So, and I enjoy that balance, and I'll never want it any different. I don't want to just drive the wagon. I want to be there in the trenches with my team, taking care of people. But I think it's important to shape what we are going to do. What's the scope of our practice? What's that going to look like? How are we going to take care of people? I see what I do as the future of medicine or dentistry. I don't know about medicine that much. But
Or you helped.
because these opportunities, as we look at single payer, as we look at some of the things that we're talking about in medical economics, we have a solution that works. And my job is to keep people well, not to cure them when they're sick. How do we do that? How do we make medicine more affordable? We don't have a healthcare crisis in the country. We have a health insurance crisis in this country. And we need to use our knowledge clinically to provide leadership to find the solutions to those problems. Otherwise, they're going to be imposed on us. So if you don't know how to lead, you're going to find yourself working under situations or in situations that you won't be very happy with. So I'd like to go down fighting for what's right.
Well, I'm a researcher. I'm a nerd, I'll admit it. I did my first computer program in 1963 on an analog computer. Okay, that's old. What's that? All right. But it's an issue of finding voice. And I am the faculty director for the Anderson Graduate School of Management Latino Executive Education Leadership Program. And it's about voice and vision. So my journey took me about 10 years to develop my voice and vision, and it included being at Davis, being at Berkeley during the 60s and the Third World Strike, setting up La Clinica, traveling a lot into Mexico and other parts of Latin America to finally sort of figure out my voice, which was good, because I graduated here in 1974 and was offered a position at UC Berkeley on the faculty as a lowly assistant professor. So I went through the process. They hired me. And so I got to meet my boss, the dean, Warren Winkelstein. He's now dead, so I can name names. So he came up to me and he said, you know, you're the first Chicano we've ever hired on the faculty. Now, I'd been there as an undergraduate. I was picketing the School of Public Health during the Third World Strike. It's not like I didn't know this, but you know, my first day on the job, so maybe I should be at least polite. And I said, oh, really? Well, he said, so because you're the first Chicano, we want you to succeed. Well, I think I do too. We want you to publish and be able to get tenure. Well, I think I'd like to do that. So we all have a word of advice for you. And I've been around the block a few times. I mean, heavily around the block. And I thought, uh-oh, I think I know what he's gonna say. And if he says it, I'm not gonna respect him. So I said, oh yes, Dean, what is the advice you and the senior faculty have for me? Don't study this here Chicano health stuff. Why not? Nobody cares. You won't get published. You won't get tenure. Well, in my mind, I was saying, that's why I wanted to go on to the faculty. I wanted to research Latino health. So I thanked him kindly and a little bit coldly for his advice and went ahead and published. And I got accelerated tenure studying Latino health. That's because that vision and publication basically is my voice. Now, I've worked actually across a lot of industries. I worked with Latinos in aerospace, high tech, Hollywood, food and beverage, banking, you name it. And I keep hearing the same stories over and over. In fact, we did a study in the 1990s of Latino executives in corporate America and what was going on. And out of that, that's how I created the program that I do out of Anderson. And it's a program that we have now, because of COVID, we did a piece of it focused more towards health, because we really needed leadership. And we call it Accelerating Leadership for Latino Health. And we also add, and you don't have to be Latino to do this, but you do need to know some stuff. And there are 4 pillars to Latino leadership in terms of developing your vision and your voice. Because if you have a vision, but you can't voice it, ahí se para, okay? The 4 pillars. There are first 2 pillars for vision. What is possible? Where might we be going? So we actually use data. I start with the Latino epidemiological paradox. 30% fewer heart attacks, 30% fewer cancers, live 3 years longer, healthier babies, smoke less, drink less, do less, drugs. Wow, so what's wrong with California being half Latino? That's not the narrative. The Latinos, they're all illegal immigrants, gang-banging, drug dealers, blah, blah, blah. I look at the data. So we get people starting about understanding just the data. Then we talk about the Latino GDP, and now it's the 4th largest economy in the world? I had no idea. That's not what they tell me. We're all living on welfare. Okay, narratives. So that gives them an idea of where we could be. I mean, what's wrong if California's half Latino? We live longer, work harder, create more economic growth. What's the problem? We have better parties too. But then comes voice. So we have the next 2 pillars. The first is what I put the term to this, the Latino double imposter syndrome. Now, you all heard of the imposter syndrome. Well, as Latinos, we get a double helping. And I'll just use myself as an example. All my life, and I was born here, I've been told I'm too Mexican ever to be American. Now, my parents were born in this country, my grandparents, et cetera. But I'm always too Mexican ever to be American. Then I go to Mexico, and guess what? I'm too American to be Mexican. And the whole point is that's not a problem. That's the beginning of your genius, because you see the things that they don't. They see things really clearly, black, white, that's it. You see all the grays. That gives you depth. That is the source of your genius. You get to define how you are Latino. And in this room, there's got to be, what, a couple of hundred Latinos here, maybe? No 2 of us are Latino in exactly the same way. And that's great. That's wonderful. That is your source of genius. Then the second pillar for voice is understanding Latino confusion about U.S. racial categories. In the 2020 census, if you remember the census, they asked you first 2 questions. Are you Hispanic or are you not? And in the 2020 census, 62 million people raised their hand and said, yes, I am Hispanic. Although in their mind, they're saying, really, I'm Chicano, not Hispanic. I'm Hispanic, but I don't speak Spanish, but I'm still Hispanic. I don't like jalapenos, but I'm still Hispanic. Okay, so we know who the Hispanics, who aren't. Then everybody said, oh, by the way, what race are you? White, black, Asian, Indian, other. Those who did not raise their hands, the ones who said, I'm not Hispanic, oh, I'm this race, I'm that race. 96% of those who were not Hispanic identified with one of those races. Latinos, when asked, okay, now you're Hispanic, what race are you? Didn't I just tell you I was Latino? No, what race are you? Well, we're a little bit European, we're a little bit African, we're a little bit indigenous, I don't see myself. 75% of Latinos refuse to answer the question on race. And that's wonderful. For a country that has been riven by race since 1787 when they wrote the Constitution and put in that 3/5 rule, and then that got built into the first US Census in 1790, we have been riven by narratives about race. And here comes a group that has a very different experience saying, we're not going to play that game. I think that is something beautiful that Latino leadership can give to the American society. We need to have a different way to talk about human samenesses and differences. So these are the 4 pillars of Latino leadership, and you don't have to be Latino to do it. You just need to understand the process, and I think we have much to offer this country's future. The only economic growth that they're going to see, a different way of looking at human samenesses and differences, and much better parties. That's the whole point.
Wonderful. Thank you for that. How are we doing on time? Should we open it up for, yes, questions from the audience? Back there. Ooh.
Aloha. I know these guys. I'm Michael Lopez. I was there the same time that David was there. It was my chair poster that you looked at, you alluded to. I'm right here, Dave.
Oh, there you are.
I'm right here. So my question, no, there's no clapping for that. My question is, do you feel the adversity that you experienced in school during those days has changed much today?
No. Next question.
Explain.
No,
Explain.
it hasn't changed. What has changed is my ability to explain to people why I am disagreeing. And I am a researcher and I deal with science. And I can scientifically base what I'm talking. I'm not, a loudmouth machista. I used to be, but I became a loudmouth nerd with data. So I am secure. I mean, at the School of Medicine, I can outpublish almost anyone on that faculty. I know what I'm talking about. I'm absolutely sure. So I know I'm going to hit all this resistance. I can blow it off. Let's talk about data, theory, methods. Or you want to talk about questionnaire construction? You want to talk about sampling? Well, let's sit down and talk. And you hear stuff like on the HCAPS, they call up the patients after a hospitalization. And I'm on the board of White Memorial Hospital, so I get to deal with this stuff. And it turned out that according to HCAPS, almost no one in East LA spoke Spanish, according to HCAPS. So actually, I called the houses. Turns out that CMS hires houses to do their research. So we talked to the house that did their research in East LA, and we asked them, so do you have bilingual interviewers? No, but we have some people that speak Spanish we can call. So what happens when you call somebody and ask them to rate their hospital stay? Oh, well, we say, sorry, we don't understand you. Give us a number and we'll call you back. Well, you know what your response rate is going to go. That's why they count only 10% of the people in East LA speak Spanish. So they're getting HCAPS ratings off a very biased sample. And by the way, that biased sample, because of certain characteristics, gives it horrible ratings. And that's going to affect their Medi-Cal and Medicare reimbursement because of bad methodology. Theory, method, data. That's what we need, and I fight right back. I'm a scientist, I'm a researcher, and I will challenge their very beliefs because their beliefs are wrong. They believe we're dysfunctional minorities. If it weren't for minorities, California would look terrible. We're going to be releasing a report shortly. As we look at all 50 states, California is the 5th healthiest state in terms of overall mortality. The 5th. But if you take diversity out, California falls to 20th. Diversity is the best thing that ever happened to California's health. That is not the narrative we hear. That is the narrative we need to tell ourselves. I don't care if they believe it or not. We need to believe it. And if we believe it, there's no stopping us. We'll make 2095 very easily and in very good shape.
I think to add meat to what you said is, when I graduated in '74, there were 6 or 7 Hispanics, Latinos, actually Mexicans in my class. My son graduated School of Dentistry in 2005, there were 4. And my daughter graduated in 2013, and there were 4. So we have not made that much progress. Mm-hmm. I don't know what your data, explain that to me in data.
Yeah.
Yeah.
Any additional contributions to that question, or?
Well, no. I have to. I actually do agree that in some places it's actually worse than others. I think we still have to go back to and say, who are we serving? And I think it's really important and incumbent on the entire population to take this thing on. One of the best examples where we ignore health in a group, I think you all know Secretary Becerra, who is the head of HSS, and although as a whole, California has really healthy outcomes, when you look at the African American perinatal morbidity mortality, it's horrendous. It's horrendous. So who took it on? HSS last couple of years under Biden, and I'm not trying to be political. It's just everybody that's practiced maternal fetal health knows that this is an issue, and no one has addressed it in a systematic funding way. And I think it takes people who can see whether it's, women see things different than men, and our different places in society, including our experiences, if we are not at the table, will not change things. And all I can say is, with regard to admissions, we are still not at the table. With regard to the faculty at the medical schools, we are still not at the table. But we do vote on funding. And if our institutions want to continue to have general funding from our general population has to speak up. That would be my response. Because you're not going to do it any other way.
Thank you. I'm Dr. Renee Navarro, and I serve as the Vice Chancellor for what was the Office of Diversity and Outreach, is now the Office of Opportunity and Outreach. I first wanted to just stand up and thank you. Thank you for providing the shoulders upon which the work we're doing now at UCSF stands. And so publicly, I just wanted to say I can't even imagine what it was like in 1974 and 75. I graduate class of 1986, so 40 years ago, and it was challenging then. I did want to say that now women are 48% of our population, of our faculty, and 55% of our learners, and so we've made progress there. Latinos are still lagging way behind. You look at the population of the state of California, 7% of our faculty, about 340 Latino faculty at UCSF now, and 13% of our learners, but 48% of the population. So we have a lot of work to do. But my question to you, as we are doing our strategic planning, we're looking at opportunities for the future. How do we live our values? How do we live our pride values and our principles of community? I would love your thoughts and ideas about, in the current situation where both as scientists, our data or the research interests that we have are being challenged and purportedly not funded at the same rates as other research. How do we sustain our young people who are interested in continuing to do this work and who need to be the future, who are feeling a little downtrodden right now? And we know sometimes we kind of go a little underground and do the work we need to do to continue to sustain people. But I would love your advice and your opinion on what we should do to really continue to move the institution forward, knowing that our goal is to relieve human suffering for all populations, and we know that closing the gap on who has access to these careers helps to close that gap. So, thank you.
Mark, you want to take that? Mark?
Last summer, I had my 80th birthday, so my kids took me to the beach. All the grandkids running around. And so my daughter, some of you know her, Catalina, she's the undersecretary for EPA for the state of California, and the past 2 years have been hell for her. So she was unloading. She said, looking at the deportations and the raids and everything else, she said, Dad, this is bad. It's like there are no guardrails. Like, this is horrible. It can't get any worse than this. And that's when I realized, and I said, no, mijita, it has been worse. I personally have experienced 5 waves of deportations in my life. My parents had a 6th wave they experienced before I was even born. the first wave back in 1929, almost exactly 100 years ago, there were no civil rights protections. Segregation was legal. Segregation told us where we could live, where we could go to school, whom we could marry. We had no say in it. There was no representation. And in the first raids during the Depression, the fire department was deputed to haul people out. And INS data, they deported 1.8 million people to Mexico. There are only 1.2 million Mexicans in California at that point. I mean, they deported more than there were. That was bad. I remember Operation Wetback, 1950s, no civil rights, everything. I remember now going to segregated pools in LA, no representation, and the US Army picked people up and threw them over the border. Then we have Operation Intercept under Nixon. They had just barely signed the legislation on civil rights. It hadn't worked its way into actually being anything, and still no representation. Along came Proposition 187, the same idea. The good thing it did is it kicked our butt. It really did. And it, particularly immigrants, it got them to get off the fence, realize their future is here. It's not going, they're not, me voy para Mexico. No, you're going to stay here. Here your kids are. They naturalized, became citizens. They voted. It welded the US-born and the foreign-born into one community. Yes, 187 was horrible, but there were civil rights protections, and that eventually was used to declare 187 unconstitutional. Latino representation shot up, and suddenly the Latino Legislative Caucus became the third house of the US Senate. Then we had President Obama, the deporter-in-chief, we used to call him. He hated it. And don't forget, he was the one who initiated family segregation and the baby cages, and denied undocumented, could not buy insurance on the exchanges, even with their own money, and immigrants up to 5 years couldn't participate, even with representation and even with civil rights. And now we have the Home Depot raids. And yes, we have representation, even though that representation was thrown on the floor and handcuffed. But we have representation, and they're pushing back. Yes, they're not obeying civil rights laws or even simple criminal procedure law, but they're there, and people are pushing back now. So I said, yes, it's bad. It's been worse. We'll get through this, and we're going to come out the other side, and we're going to be okay. Only because we roll up our sleeves and get into the mix.
And I'd like to add, Renee, that the most important thing you can do is network and support. Don't you think? I mean, I wish we had the money we have now, even though there's not much money right now, but it wasn't even allowed. You know, just none of this research at that time was allowed. But the students who want to be there will be there. And you, in the position that you have power to keep their little souls going. Because, honest to God, that's what it takes. It takes saying, you can do this. If it's not working now, it'll work in a few years and it'll work later. And nothing stays the same. And the thing that I have to tell you, and this was something my late husband, and some of you knew him, Dr. Frank Mesa, used to start his audiences by saying, this is not a racist presentation. They were very similar to this. And don't be racist, because you don't know what your grandchildren are going to look like.
Yeah.
And the thing that I love about us, Latinos, is we tend to be inclusive. Maybe not always happy about it, but we tend to be inclusive because that's where our history was. And the real history of America was not Plymouth Rock. Okay? The real history of America was in the Caribbean and in Florida. And it was a very mixed, not particularly nice, but it was a very mixed society that included people from all over the world. My grandchildren are half Mexican, that's us, Asian, Chinese, Hungarian, and Russian. But I always tell them they're Mexicans. Just the same.
I think we have time for one last question.
I'm
Thank
sorry.
you.
Hello, my name is Toddy Aguilera, and I co-chair the statewide CLAW. Thank you all here, both the audience and the panel, for being here with us today. For those that I think may know this, UC is considered one of the best university systems in the entire world. And we're very fortunate to say, because of the work that you've done and many of you out there, that 27% of our undergraduates in the UC system are Latino. That outnumbers many of the non-minority folks, and they're seeing, they can't believe it when we speak to that. But my question to you is, every year we graduate more and more Latinos from the UC system and other CSU and community college system. How can those that are organized as alumni organizations like the CLA be a voice to many of the issues that you are addressing today? And I'd like to address that to Dr. Batista and then yourself. Thank you.
Well, it's very simple. In higher education, money talks. Okay, what do alumni do? They donate. When I first transferred to UCLA, I was talking to one of the vice chancellors, and I mentioned, we have to have a Latino Alumni Association. And he said, look out the window. And of course, the Gardners, I think, they don't have any money. Why should we do that? And I've been hearing the same phrase for all my life. But Latinos have created the world's 4th largest GDP. Here in California, our GDP is over $1 trillion. And again, if you heard Newsom boasting about California being the 4th largest economy, that's thanks to Latinos. We pushed California beyond Japan. Actually, we produce a lot. Maybe our pay is not, but we produce. We need to make sure people understand we are the future of the economy of California. And we can give now, we can give more later. And when we're producing GDP, by the way, everyone benefits, not just Latinos. Everyone benefits. Higher wages, higher standard of living, more economic opportunities. Latinos are making economic opportunity possible for all Californians. We need to understand what we bring to the table, and we need to make sure other people understand what we bring to the table. That's why Latino alumni are really important for the UC system.
I do want to make a comment and be able to say that I do
Mic-
want to make
microphone.
a comment that
Please.
at every UC system there is a UC Foundation, which is the money arm of the University of California. And in almost, I think, 8 of the 10 foundations that raise money for the university, we have Latinos who are on that board. But to be on that board, you typically have to give $50,000 or above, so our representation is limited, but we are growing in numbers in giving back to the university, not only dollar-wise, but also volunteer-wise.
Well, if I could just add just one comment on that. As we look at the Latino GDP in California, the #1 sector, the biggest sector of the Latino GDP is not construction. It's not agriculture. It's not restaurants. It's in finance, real estate, and insurance. That is our biggest sector. Hello, we are there. We are there.
Muy bien, bueno. Aquí está muy buena la plática, but we have to...
Tertulia, por favor, tertulia.
Tertulia. It's a really wonderful chat. I wish we had more time, but I'm being heavily pressured to, in a very, very nice way, to close us out. But I really, really thank you, all our panelists. And so your insights have been incredible, and more importantly for me, your inspiration. You have really inspired me to continue to do the work. Central Valley is in such need, and UCSF has a strong presence there, so we're incredibly grateful for that. So thank you for sharing your experiences with us.
Thank you.
Thank you all so much for being here. We have some special gifts. My colleague Alexandra Velasquez is going to give to our today's guest speakers. Another round of applause. And for our distinguished moderator and Vice Dean of UCSF Fresno, Dr. Jose Boral Sanchez. Yeah. A little housekeeping, please, if you want to continue to talk with our distinguished guests, please join us in our lounge outside of the atrium, Comunidad con Cafecito, Community and Coffee. We'll have some desserts and some coffee, and please network with one another. And also, on behalf of CLAW, the Chicano Latinx Alumni Association, the UC-wide organization, if you want to get involved, especially for you young grads and young, future leaders, please talk to Alexandra, talk to any of our guests today, and they will tell you how to get involved with CLAW. It really is a meaningful organization, and it's a UC-wide effort, so we have representation at all 10 campuses. Do you want to say anything?
Thank you so much for coming.